Well, welcome to Healthy Chats with the Doc. Today we have Dr. Elisa Cicerone, and we're going to be talking about breast tenderness. So, Doctor, thank you so much for joining us.
You are so welcome. Lovely to see you.
It's great to see you too. With COVID, it's been way too long since I've been able to see all the doctors, so it's great. So, Doctor, talk to us a little bit about breast tenderness can be really common. And of course, as we get older, we get nervous about breast cancer and those types of things. So talk to us a little bit about what is breast tenderness and is it common and when should you get concerned? I mean, just at the overall, and then we'll start drilling down.
Okay, so it's definitely something that's common and people experience it in all different way. I think we typically think about women having breast pain and tenderness, but it happens in men too. So with women, it's typically with different times of their cycle. So women that are premenopausal, it can be at different times of their cycle. Ovulation, we get a lovely estrogen spike. Sometimes when women are getting their period or right before their period, they'll get that kind of like really tender, especially around the nipples. A lot of times when estrogen is elevated in our normal cycle, we'll see that breast tenderness. Sometimes we get those sharp pains to the breast. And that can be because we had an injury to the breast, right? So a lot of times if we have a fall, or I walked into my clothes dryer the other day in the middle of the night and I hit myself. So we can have just injury to the breast that can cause some tenderness too. Any types of sports injuries, things like that. The most important thing is if it's coming and going, we're not as concerned. But what I have noticed, and I think that we forget to talk about too, is a lot of times when women have breast augmentation or they have implants, there can be what we call a capsular contracture. And that's where we actually form scar tissue really tightly around the implants, and it can kind of compress and squeeze the implants. So a lot of women that have implants can actually have that tightening and that pain too. And sometimes that pain in general can come from actually like the chest wall, so the muscles underneath the breast tissue too. So there are lots of different ways that it can happen. There are lots of different causes. Fibrocystic breasts can cause it too. So I think it's really just paying attention to, is it coming and going or is it always there? What's the quality of the pain? Is it a deep ache? Is it a sharp pain? Is it tenderness on the skin? And do you notice that it's happening, with periods or around menstruation? Or is it just happening all the time, really sporadically?
Yeah, thanks. Because I think what happens is, especially as you get older and, it's like, okay, well, make sure you do your self exams and, especially if you're athletic at all. Of course, my age group, we're all playing pickleball and
Totally.
those kinds of things. So, and I know that, you have a rich background in oncology as well. And so talk to us a little bit about actually breast cancer and breast pain. There's not a lot of correlation, right? I mean, there is, but don't be concerned necessarily if you have breast pain.
So yes, I agree. And I would say that usually for the majority of people, a breast tumor, so actually a malignant tumor that could be breast cancer, those are usually painless actually. So that's why self-exams and imaging are so important, because it's not usually something that we feel. I would say the exception to that, though, is a type of breast cancer that's a very rare form of breast cancer, and it's called inflammatory breast cancer. That can cause pain, and there can actually be visible changes to the skin. So that is the one thing where a lot of times people will think, oh, this is just a rash, or I'm reacting to my new detergent, or I have eczema, but it's actually a type of breast cancer that shows up on the skin. So I think being aware of your breast tissue, being aware of how it feels. I mean, most lumps, bumps, cancerous tumors, or non-cancerous masses are actually not found by your doctor in your yearly physical. They're actually usually found by the patient or their partner. That's how most breast masses are found. So I always say, be aware of anything that's new, right? Is there anything in the breast tissue? And also in your underarm, right? In your armpit, that's a very common area for lymph nodes to be enlarged. Are you noticing that there's a certain part of the breast that's swollen or seems a little bit bigger? Are you noticing any thickening of the skin? Are you noticing any irritation to your skin, right? Is there dimpling? Does the texture look different? Any flakiness, any redness in the nipple area as well? And then one of the things that can happen too is masses in the breast, they actually can pull the tissue in. So you can actually see sometimes where the nipple is pulled in, like towards the chest wall, and that can be a sign of a mass there too. So those are the things we watch for in terms of something more concerning like breast cancer. But in general, just normal aches and pains are typically not anything to worry about.
Yeah, and so you mentioned it earlier. You talked about dense breasts or also, fibrocystic breasts.
Mhm.
So because that can be kind of misleading, right? It's like,
Yep.
is that a lump or
Yeah.
is that tight? So is that a common thing, or is that just is it something that you're kind of born with, or does that relate to lifestyle,
Yeah.
or what about all those things?
So fibrocystic breast can definitely develop and the tissue can change. It used to be called fibrocystic breast disease. And now we know it's actually not a disease. It's just how our breast tissue can change, right? And our breast tissue can change with menstrual cycles, with hormone fluctuations, with pregnancy, with perimenopause, with menopause. That breast tissue is changing. So fibrocystic breasts tend to have these little lumps or cysts, and they can be more tender. What we notice with those is it's usually right before your period when you're having that pain. And it can also be at times like when hormones are fluctuating. So I say our big times of hormone fluctuations are about midway through your cycle when you're going through ovulation. And then as you're leading into your period and during your period, those are the times when we see the largest elevations and fluctuations in hormone. So again, some women notice they just kind of have lumpy breasts. I have a lot of my patients say, my breasts are just really lumpy. I don't know, what I'm feeling. So it is really important. I'm a big fan of notes. I love taking notes where I have it written down. So I know, oh, is this new? Is this not? So noticing, okay, I always feel this area right here. That every month I notice that kind of gets a little bit, tender or swollen. Or I always notice this bump right here. It's here all the time. It kind of gets bigger and goes away. Noticing things like that. And always pointing those out to your gynecologist or your primary care doctor as well when you're going in for your exams. But it's not uncommon to have fibrocystic breast. And again, our tissue is changing all throughout our lifetime. So it's just paying attention to new things.
Yeah. So I mean, because we all know that, mind body integration and those kinds of
Yeah.
things. So don't go down the rabbit hole necessarily, right?
Yes.
With some of those things. Yeah. And so you mentioned hormones and hormones affecting breast tenderness and pain. And as you know, we work with a lot of perimenopause and
Mhm.
menopausal women.
Yep.
Can you talk a little bit about a lot of women talk about when they start taking progesterone or even
Mhm.
estrogen, sometimes they start feeling tenderness, and
Yeah.
sometimes it's just when they start, or sometimes it is in their cycle.
Yeah.
Talk a little bit about how the hormones, especially with hormone replacement therapy, might be part of that process.
So I think that a lot of times with hormone replacement, it can definitely be happening when we're starting something new, right? So it really depends on when we start hormone replacement therapy, like sometimes how noticeable it is. So a lot of women that have, experienced menopause and are well into menopause before starting hormone replacement therapy, their levels have gotten pretty low, right? As opposed to somebody who might be starting hormone replacement therapy in perimenopause or right as menopause is beginning. So I think when we've had lower hormone levels, when we start a new medication and we're getting, hormones from outside our exogenous hormones coming from outside of the ones we're making, it can cause some shifts. And so initially, women can have a little more tenderness with progesterone, sometimes with estrogen too. I've had a number of patients come in to me that are getting non-bioidentical hormone replacement where they're just getting a very high dose of just straight estradiol. And I've noticed too, there sometimes their levels can be really high, and too much estrogen can cause that tenderness and pain. It almost feels like they're like, "Am I getting my period again? I feel like I'm PMSing, but I haven't had my period in 5 years, right?" And so when their body's being used to that, especially if the doses are too high. Um, there are some other medications that I've seen too. Again, I wouldn't say I commonly see this, but I have seen it. So some antidepressant medications like SSRIs, right? So Zoloft, Prozac, things like that. I've had a few patients where when they've started that medication, they've noticed a little bit of breast tenderness and pain. And then also some different medications for blood pressure. So I've seen a few different medications for blood pressure where people will get a little bit of breast tenderness in relation to that. But I would say most commonly we see it with hormone replacement therapy. And especially when starting out hormone replacement therapy, or if the doses are a little more than you need.
Yeah, but yeah, because sometimes it is a side effect of a medication, and I mean,
Yeah.
because you're a functional medicine doctor, you're personalizing it.
Yeah.
Well, speaking of being a functional medicine doctor, there are some lifestyle and diet and nutrition that can
Yeah.
affect breast pain too, like caffeine, right? So talk to us a little bit about
Absolutely.
lifestyle.
I think that was one of the first things I learned in medical school, was about how caffeine can impact fibrocystic breasts. And I just, one of my, we were young, we were in our 20s, but one of my good friends had fibrocystic breasts, and she noticed that when she would have caffeine and she would have coffee, she would feel it. It was much more lumpy and bumpy than when she cut coffee out. So I noticed that was huge, and I saw that firsthand. Um, People react differently to different foods too. So there can be different inflammatory foods, right? So we think about things like wheat and gluten and dairy, and even some inflammatory vegetables, like corn and potatoes, things like that. That in those of us that tend to get inflamed a little bit more easily, can also affect the breast tissue as well. Um, Everyone's so different with how they react to certain foods, right? Some people have those more inflammatory foods, they feel fine. Some people, like me, I look at a piece of bread and my joints start hurting. So it just depends how we react. And I always think it's like what our constitution is, right? Do we tend to have that more inflamed constitution? Um, One of the things that I don't think we think about too, are the bras that we wear. So especially in women that have larger breasts, right? They're more well endowed. Um, there are all of these different ligaments that connect the breast tissue to the chest wall. So our chest wall is all the musculature underneath the breast tissue. And when those ligaments in the breast are not supported well, those ligaments can almost become kind of overstretched, right? They can become like kind of pulled. And so that can be really painful too when you've been going all day, especially when people have very active jobs and they're moving around and their breasts are not supported. Those ligaments can have strain too. I would say even women with smaller breasts, when you're exercising, when you're running, when you're doing high impact activities, if we're not wearing the right support and there's a lot of movement with the breast tissue, that can also impact those ligaments and kind of pull and stretch them. And that can cause breast pain and tenderness too. And sometimes, like I said, what we're feeling is not actually in the breast tissue itself. It's kind of radiating out from that chest wall, from our pec muscles and the muscles behind it too.
Yeah, that's a really good point. I happen to be a double D. So
Yeah.
and I was a very young age, like, and I was an athlete. And so, yeah, the bras matter.
Absolutely. And the
Yeah.
thing now though is there are such great sports bras that they're making,
Yeah.
where it used to be this thing you had to like wrestle over your head and pull down, and it was like, would smush your boobs and it was too tight around your rib cage. Now there are so many ones that are adjustable, where you can adjust the band size, they
Mhm.
zip on and off, you can adjust the strap. So it's really more of like a custom fit for you. And I think that's super important for breast health too.
Yeah, it's funny. We don't think about bras, but I mean,
Yeah,
they're pretty tied together, related
absolutely.
to breast health.
Yeah.
So talk to us, like, the one thing, I get the caffeine, right? It was funny when I was listening, and read Michael Pollan's book, right?
Hmm.
You can change your mind, but he talked about caffeine being a drug, right? And
Yeah,
forget that, because we just love our coffee so much in the morning.
totally.
But talk to us about stress. How does stress possibly affect breast pain?
Well, I think in general, stress leads to a lot of body inflammation, right? A lot of systemic inflammation in the body, so that we know that high cortisol levels and stress can actually start increasing different reactive and inflammatory proteins in our body. So when our body senses that stress, our bodies don't know that we're stressed because we have a deadline at work, or we're running from a bear, right? So we start making all of these proteins and hormones that start like revving us up, and that can absolutely lead to more chronic inflammation and more systemic inflammation. So that for me is the real thing, the stress being tied in with the inflammation.
That's we forget how stress just really wrecks everything
Yeah.
internally, and breathing, meditating. They're
Yeah.
not just woo guru. They really do work. Yeah.
Yeah, well, you're right. We're balancing that fight or flight nervous system, right? Our alarm state, our sympathetic nervous system, with our rest and digest and relax, our parasympathetic nervous system. We're supposed to be able to kind of toggle back and forth as needed. But for so many of us, right, we're going nonstop all day long. We get really stuck in that sympathetic nervous system, right? We become very dominant in that side of our nervous system. And then we're constantly in that fight or flight mode. Our bodies don't really get a chance to settle down and get out of that. And so how our body reacts is like inflamed, throw that blood around. Like,
Yeah.
let's get ready. Let's get ready. We're either going to be fighting that bear or we're going to be running from it. So we've got to be ready.
Yeah. Well, last question, because wow, time goes fast.
Time
So
flies.
when should you go to see a doctor if you're having breast pain? I mean, like what would you tell your patients?
So I think in general, it's always better to have things checked out and have peace of mind, right? There's never a downside to going in, getting things checked out, and having more information. So if it's, once or twice, you might feel a little sharp pain. I don't worry about that so much. If it's something that's fleeting, it comes and goes, it doesn't happen again, I don't worry about that. If it's something that really is related to your period and you're noticing it and it's mild pain, it's just a little bit of discomfort, I don't worry too much about that. If it's anything that's chronic, if it's happening moderately to severely on a really regular basis, if it's something that's new, if it's a new type of pain you haven't experienced and it's not going away, or if it's something honestly that you think about and you worry about and you're going, gosh, I don't know, I'm not sure, go in and get it checked out. I've never had a patient say, I wish I didn't go in. I wish I didn't have that mammogram. I wish I didn't have that breast exam, right? But I've had a lot of patients who have said, I really wish I'd done that sooner.
Right.
So I think it's really important whenever you feel like something is off, trust your intuition, go in, have a discussion, and make sure that you're being heard. Make sure you have a doctor who listens to your concerns, who doesn't dismiss them, who doesn't say, oh, it's just nothing. Because there are times when that's happened. And I personally, my best friend, that happened to my best friend. She was pregnant. She felt a lump in her breast. She was 34 years old. The doctor said, oh, it's just pregnancy related breast changes. You don't even have to worry about it. Right. 3 months later, she was about to give birth and she goes, gosh, I'm having a lot of pain and I can't really move my shoulder well. Gives birth, and 3 weeks later, after she gives birth, is diagnosed with metastatic breast cancer. So we know our bodies. We know when something is off. Trust your intuition and make sure that you are being heard and listened to by your doctor. It's the most important thing.
I mean, it's great. I mean, your doctor is a very important relationship, and you want to make sure that you're resonating with them, and
absolutely,
they're like your health consultant, right?
They're the person you're trusting with your most important asset, right? Your health.
Exactly.
So,
yeah, health is the new wealth, right?
Absolutely.
Well, Doc, we are out of time, but I can't thank you enough. And it was wonderful to see you. I haven't seen you in long, so it was great to see you.